Do you need a neck cream? I get this question all the time. So today we're going to talk about skincare and procedures that can optimize the health and appearance of the skin on your neck. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. This video includes a partnership with Strivectin. I'm going to tell you about a neck cream that might be a great addition to your skincare routine. One of the reasons I really wanted to make a video about neck skin and neck care is because I feel like people go through their lives not really noticing their neck or really thinking about it, and then one day someone wakes up, they notice their neck, and then it's all they can focus on. We always make this stupid pun in dermatology saying that the neck gets neck-glected, but it kind of does. Everyone's focusing on their face. It's what they've sort of been trained to look at their entire lives, and they invest a lot in their facial skin, their facial care, whether that's through products that they're using or procedures that they're investing in, and a lot of times people neglect their neck. And then it gets to a point where they go, uh-oh, I need to reverse some of the damage that I'm starting to see, and that's what we're gonna talk about today. If you're someone who's watching this video because you are bothered by the skin on your neck, then you've also probably realized that the skin on your neck really is different than the skin that's on your face. It's much thinner, it has fewer oil glands, it's also more elastic or stretchy, which is great, except when it starts to age, because as soon as you start to lose that elasticity in your neck, it starts to take on a drooping or saggy or crepey appearance. Also, I always want people to keep in mind that there is a huge genetic component to how your neck looks as it ages. And often when I have patients coming into my office to discuss neck rejuvenation, one of the things they'll tell me is, oh, I'm starting to see my mom's neck in my neck, and that's how I know I need to step in. Similar to treating aging in the face, the neck requires a comprehensive assessment of all the factors that are contributing to the aging process there. This includes loss of volume, increased skin laxity, worsening tone and texture, as well as wrinkling and crepey skin. Ultimately, to optimize the skin on the neck, it really takes a multifaceted approach. And you're going to get the best results and the most noticeable results when you use a combination of treatments. The final thing I'll mention before we get into the various interventions that you can do for your neck is that you want to be proactive as much as possible. Yes, a lot of us start to notice our neck, and so we are reactive in the treatments that we choose. But if you're at the point where you're just starting to think about your neck, this is the time to intervene. Let's start off by discussing skincare that you can use at home to improve the appearance of your neck. I've sort of broken this down into specific categories, so I'm going to start with neck-targeted products, aka neck creams. Now, of course, not all neck creams are created equal. They have different ingredients, they have different formulations and textures, but today I'm going to focus on the Strivectin TL Advanced Neck Cream Plus. This is literally the best-selling cream in the United States, specifically for the neck and décolleté. This is a super rich and nourishing cream, and a little goes a long way. I wanted to take note of how thick and creamy it is because that's very important when treating neck skin. Like I mentioned before, the skin on the neck is super thin, and it doesn't have as many oil glands, so it's more prone to dryness and that creepy appearance. Let me show you the texture of this. So really rich and creamy and luscious, and I'll put it on my neck for you as well. When you use a neck cream, you don't need a lot. A little goes a long way. This has their Gravitate CF lifting complex, which improves elasticity as well as provides visible tightening. It has their patented form of niacin, which helps with the skin barrier, which is super important if you're using other ingredients on your neck that cause irritation like retinol, like I do. Then anything that's gonna help kind of restore that skin barrier is great. And then it also has their botanical brightening complex in it, which is going to help even out the tone of the skin on the neck, which can kind of start to become a little bit mottled and dyspigmented as we get older and accumulate sun damage. So it hits on all the things that you kind of want in a neck cream. I also think this is a good example of where having a specific neck and décolleté cream can be helpful. Some people don't want that thick or rich texture on their face. Maybe they're acne prone, maybe they have oilier skin, but their neck still needs that kind of support. And so having a neck dedicated product in that case is helpful. Strivectin, as sort of an anti-aging brand, has been around for a long time, and it's really given them the opportunity to perfect this formula. It is shown to improve the elasticity of the skin. It's also been shown to visibly firm and tighten the skin. And I make that point because yes, of course, we want the skin on our neck to be healthier, but we also want it to look better. So having those types of clinical results, I think, is important. Now, later in the video, I'm going to talk about in-office treatments that you can do to improve the appearance of the skin on your neck. And I want to be very clear. What you can achieve with a neck cream is not going to be the same as what you can achieve with in-office in-office treatments, but I really think skincare and procedures complement one another and work together. The next skincare category that I want to focus on when treating your neck is use of topical retinoids. Retinoids have multiple anti-aging functions. They help expedite cell turnover, so that can help with things like dullness and irregular pigmentation, but they also help you create more collagen and elastin in the skin, which can help with things like fine lines and wrinkles and overall textural abnormalities. Retinoids are sort of the gold standard anti-aging ingredient for your skin, but you have to be really careful when you're using retinoids on your neck because the number one side effect of retinoids is skin irritation, and your neck is much more prone to irritation than your face. There are different types of retinoids. So there's prescription retinoids like tretinoin, which are quite potent but also quite irritating. And there are less strong retinoids like retinol, which may be a better choice for your neck skin. One of my favorite retinol products, and I've spoken about it on this channel before, is Night Shift by Stratia. It uses a 0.15% encapsulated retinol, and retinol exists in different strengths as well. It usually goes from 0.1 up to 1.0. So this is on the lower strength of retinols, but that's why I like it for the neck because it's less likely to cause irritation. In addition to that, this formula has some great hydrating and emollient ingredients, which help sort of mitigate any of the irritation that you might get from a retinol product. Now, I love this for the face as well, and I often recommend it to beginner retinol users, but I think it's also a good option for the neck skin. I recommend applying your retinol at night after you've cleansed and dried off your skin. When you apply it to dry skin, it's less likely to be irritating. After you've applied your retinol, I often recommend following it up with a moisturizer. You could even use the Strivectin neck cream on top of your retinol to enhance your results. Now, even though retinol can be a very helpful anti-aging skincare ingredient for the neck, not everyone's neck will be able to tolerate a retinol. And if that's you, just know that it's okay. There are other things that you can do to enhance the skin on your neck, and not all is lost just because a retinol doesn't work for you. So another category of skincare ingredient that can be helpful for skin on the neck is growth factors. Growth factors are proteins and essentially serve as chemical messengers to tell your skin cells to behave in a certain way. And there are some small studies that show that topical growth factors can help with things like skin tightening, firming, and reduction of fine lines and wrinkles. Now, the thing about topical growth factors is they can be very hard to formulate. And typically, if I'm thinking about using a topical growth factor agent in my skincare routine, I'm going to invest in one that has some research and development behind it and has some proven clinical results. And that's typically why I will recommend the Skin Medica TNS Advanced Serum. Now, this is probably the most expensive skincare product that I talk about or that I recommend to people. And again, it's not something that is an essential in your neck skincare routine, but if you're trying to kind of do everything, hit it from as many angles as possible, this might be a nice addition. Peptides are another category of skincare ingredient that can be helpful in improving the appearance of neck skin. Similar to growth factors, peptides can also act as signaling molecules, telling your cells to behave in a certain way or produce certain things like increasing collagen production. Now, to be clear, there are so many different types of peptides that get incorporated into skincare, and just because skincare says it has peptides, that doesn't really mean anything. You kind of have to look at what types of peptides are being incorporated and what have they been proven to do. That's a big reason why I like the Elastin Restorative Skin Complex. This is a peptide product that utilizes Elastin's proprietary trihex technology, which is a blend of peptides and botanicals that have been shown to help clear out damaged collagen and elastin from the skin. And when you're thinking about skin rejuvenation, and specifically neck rejuvenation, of course you want to be making new collagen and elastin and really supporting that neck tissue, but it also can be helpful to correct old photo damage. Speaking of photo damage, a huge part of optimizing the health and appearance of your skin is protecting that delicate skin. So of course, the number one thing you need to be putting on your neck every day is sunscreen. Now, although specific neck creams may be helpful, you do not need a specific sunscreen for your neck. If you want some specific sunscreen recommendations, I have tons of videos here on YouTube that talk about my favorite sunscreens. I also have a sunscreens review highlight on my Instagram that you can look at. So this is just your friendly reminder from a dermatologist that whenever you are putting sunscreen on your face, bring it down to your neck, bring it down to your chest if your chest is going to be exposed, and don't forget your ears or the back of your hands either. I know this is a neck video, but I'm never going to miss an opportunity to remind you to apply sunscreen. Another ingredient category that can be helpful in protecting the skin on your neck is vitamin C. Now, if you've heard me speak about vitamin C before, you know that I don't feel that it is an absolute essential to a skincare routine, but it can be very nice to have, and it can help boost the efficacy of your sunscreen in terms of protecting you from UV damage. The reason I want to remind you that it's not an essential in a skincare routine is lots of people cannot tolerate vitamin C on their neck skin. Again, it is something that can irritate the skin, similar to a retinol, and some people just find that even though the vitamin vitamin C works great on their face, when they put it on their neck, they have too much irritation. Now, if you don't find that your neck skin is sensitive, absolutely take the vitamin C that you're using on your face every day and extend it down to your neck. A vitamin C that's really affordable that I recommend to lots of people is the Maylove Glow Maker. This vitamin C is formulated with L-ascorbic acid, which is the most studied form of vitamin C. And to incorporate it into your neck, you probably just need 1 to 2 drops. A little goes a very long way. So that's sort of a wrap on skincare that you can use for your neck. Vitamin C and sunscreen to protect, and then things like peptides, growth factors, retinol, and then targeted neck creams with clinically proven results to help optimize that skin. Now, for more intense and dramatic results, you can start incorporating in-office procedures. Now, one thing I'll say as a cosmetic dermatologist who performs lots of rejuvenating procedures on the necks and faces of people on a daily basis is the fact that neck skin often does not respond as dramatically to in-office interventions as facial skin. And again, that is because neck skin is different than face skin. Neck skin really is more delicate, and you have to be very careful. You cannot use the same laser settings that you would use on someone's face as you would use on their neck. You have to turn it down. Same with a chemical peel. You cannot always use the same strength of peel or strength of acid on someone's face as you use on the neck, because the neck has decreased healing capacity. And so if you try to use the same settings on the face as you do on the neck, you're likely to cause injury to the neck skin. And this is such an important point. Even when I teach my fellow dermatologists about cosmetic dermatology, this is something we really focus on, because lots of times people try to do the same thing for the neck and the face, hoping to rejuvenate them equally, and they end up in a world of trouble. And because we have to treat the neck with such care, it may mean that you need multiple treatments on your neck to achieve the same thing that a single treatment on your face could do. And I really mention these things to set expectations. And that's something I really focus on as a dermatologist when I'm speaking with my patients, is being very honest and open about what is truly achievable with the interventions that we have in the office. If your expectations do not match the reality of what non-invasive cosmetic procedures can offer, your dermatologist is going to be unhappy and you're going to be unhappy too. So with all of those caveats mentioned, let's talk about in-office neck rejuvenation. Now, this is just an overview. If you want an in-depth video on in-office neck procedures, or you want specifics on one of the things I'm talking about, let me know in the comments below. I like to divide up in-office procedures, or think about them in terms of what neck issue they are really trying to correct. Unfortunately, there is no single intervention that's going to correct all the things you don't like about your neck, and they each have very specific purposes. First, let's talk about discoloration. And this is much more common in fair-skinned individuals, but many people, as they accumulate sun damage over their lifetime, will notice that the skin on their neck takes on a reddish or brown color. In addition to that discoloration, the texture of the neck skin also tends to change. It becomes more bumpy or even mimics chicken skin. And that entire process of having the discoloration with the change in texture is called poikiloderma of Savant. This discoloration can often be improved with lasers or other energy-based devices like IPL or BBL. What specific device I'll use on my patient is very patient specific. Sometimes I will use an IPL to help with the reds and the browns. Sometimes I will first treat them with a pulse dye laser, which is a laser that targets exclusively redness in the skin. And once we've removed a lot of the redness in the skin, I will then move on to a separate laser to help with brown spots and texture, for example, a Fraxel laser. Now, there are so many different types of IPL or BBL or lasers that can target pigment and texture. And I don't want you to get hung up on what specific device should be used. That should be sort of guided by the person treating you. They're there to help you. What I can do is encourage you to be seen by an expert and by someone who has access to a wide range of technology. That way you can be assured that what you're being offered is really the right intervention for you, and they're not just recommending something because it's the only device that they have in their office. In addition to lasers and IPL, you can also use chemical peels on the neck to help with discoloration and texture. But I will say chemical peels are not amazing for the neck. Again, because that tissue is so delicate, you cannot use super strong acids in that area. And so the amount of improvement that you can achieve with a chemical peel is limited. Now, I would say even more so than pigment, people are often really bothered by the texture of their neck skin, whether that's fine lines, wrinkles, crepiness, or a little bit of sagging. So let's talk about what we can do for that. One of my favorite things to do is use biostimulatory fillers. So the word filler kind of gives the misconception that it's just filling up tissue, but not all fillers work that way. And there are biostimulatory fillers like Radiesse and Sculptra that use their particles to help stimulate collagen and elastin formation in the tissue. So rather than using biostimulatory fillers for actual filling properties or to increase volumization, we're really using it to fortify the neck skin. I would consider this to be an advanced technique. Obviously, there are tons of important structures within the neck, so you need to be incredibly careful and precise when you're injecting injecting that area, but I think this intervention offers some really amazing improvements for my patients. In addition to using biostimulatory fillers throughout the neck, we can also take traditional hyaluronic acid fillers, which have more of a gel-like texture, to fill in individual wrinkles. And oftentimes that is the best way to correct those horizontal neck bands that bother so many people. Now, one thing that is very much worth mentioning about horizontal neck bands is they are often caused by repeated bending or looking down. And of course, they also have this genetic component because many people have horizontal neck bands even from when they are a child. But we cannot expect to fully eliminate those no matter how much product we use in the neck. The goal is always going to be improvement, not elimination of the issue. Now, in addition to having horizontal necklines, people can also get these vertical neck bands, also known as platysmal bands. These often become much more prominent as we age, and not everyone has them, but when you do, it can, one, masculinize the neck, and two, it can make the neck appear older. Now, the great thing about these vertical neck bands is they tend to be very responsive to neuromodulator injections like Botox or Dysport. We use those injectables to help relax those platysmal bands, and then they become a lot less obvious. The other thing the platysma muscle does is it pulls down on the lower face. So when you inject Botox or Dysport or Jeuveau or Xeomin or Daxxify, any of the neuromodulators into those vertical bands, it can also improve the appearance of the jawline because you're allowing that jawline to sort of float up and not be tugged or pulled down by an overactive platysma muscle. The other way I will use neuromodulators in the neck is to use a very dilute form of Botox or Dysport and to inject it very superficially throughout the neck tissue. So rather than that working on the vertical platysmal bands, that will help improve the overall crepey texture of the neck. In addition to injectables, there are also devices that of course can help lift and tighten the skin. Typically these use ultrasound heat or radio frequency heat to get the tissues to tighten and lift and contract. Now, anytime I talk about heating of the skin or other people talk about it, one of the big concerns is, well, is that going to melt my fat away? It should not do that if it is done properly. And again, that is why it is so important to see an expert. It is not so much about the device being used, but whose hands is that device in, and are they going to give you safe and effective results? I also want to emphasize again that it is the combination of treatments that give you the best results. And these are really non-invasive options. Now, some people's neck skin is, I don't want to say too far gone, but they have a degree of laxity or sag that is really not correctable with non-invasive skincare treatments that you might get in a dermatology office. And that's typically where plastic surgery comes in. And a lot of patients will come to me for a neck rejuvenation consultation because they are seeking non-invasive or less invasive options, but I am very straightforward with my patients. And if I truly feel like they will get the optimal benefit from surgery, then that is what I will recommend. And sometimes people will go, well, it's okay, I don't expect surgical results. Can we just do something that's non-invasive? Will that help? And I will only recommend those non-invasive options if I think it will make a truly noticeable difference. And I think that's another component of being a cosmetic dermatologist that comes with experience and practice, is not just knowing who you can help, but also knowing when someone's condition is beyond what you are able to help them with and how to refer them to the right specialist to get them the results that they're seeking. And I think that's a great place to end this video. Do you have any added tips for neck skincare? Put it in the comments below. We all want to know about it. Don't forget to like this video and subscribe to the channel, and I will see you next time.